Good morning. My name is Alecia. I'm going to be your nurse today. How are you feeling?
Good.
Good. Okay. I'm just going to wash my hands real quick. I'm in here to do your physical assessment. Would you like me to shut the door?
Yes, please.
Sure. Okay. Closing the curtain. Can you tell me your name and date of birth, please?
Kaylee, January 26, 1998.
Okay. That matches what's on our wristband. Are you in any pain this morning?
Just my ankle.
Okay. What happened?
I twisted my ankle.
Is that the reason you're here?
Mm-hmm.
Okay. I'm going to start by assessing your vitals. Here's your pulse ox, your temperature. Okay. Your blood pressure is 114/86. Your pulse ox was 97. Your temperature was 98.4. Your heart rate is 86, and your capillary refill, it's almost immediate, so that's awesome. And your respirations were 16. When you fell and hurt your ankle, did you happen to hit your head or anything? Okay. I was just inspecting for bruising. I didn't notice any, so that's good. Okay. I'm gonna feel your frontal bones, your maxillary sinuses, your lacrimal glands under your eyes, and your temporal mandibular. Did you feel any discomfort when I was doing that? Okay. With my otoscope, I'm inspecting the auditory canals and the tympanic membranes. Okay, each ear is symmetrical, so that's awesome. Tell me if you can hear this. This is called the whisper test. Okay, your hearing is fine. Now I'm going to test your eyesight. If you don't mind, just look straight for me. Maybe. Your pupils are equal, round, and reactive. We're going to test your visual fields, okay? Can you tell me which number I'm holding up?
2, 2, 1, 2.
Okay, and can you follow my finger? Okay. Now, if you don't mind, just look up so I can look in your nose. I was looking for your turbinates, your nasal mucosa, and all that looks fine, and your septum looks completely normal. Can you close your eyes for me? Can you feel that?
Mm-hmm.
Can you feel that?
Mm-hmm.
Okay, that was testing cranial nerve 5. And can you scrunch your forehead? Smile, puff out your cheeks, and that's testing cranial nerve 7. Okay, and I'm gonna have you say and that was by doing that I was looking at your lips, your teeth, your gums. Do you have any appliances, dentures, braces?
Just my retainer.
Okay, and have you ever had any injuries to your nose? Okay. And I'm just gonna feel for your lymph nodes. Your occipital is in the back of your head, your submandibular, and then your submental. They're not inflamed or anything, so that's good. And now I am going to feel for your carotid arteries. I would do both at a time, but if I were to do that, it would almost cut off blood supply. We definitely don't want that. There's no jugular vein distension present, okay? I'm gonna listen with the bell of my stethoscope, okay? If you don't mind to look to the side and take a deep breath for me. Hold it. Okay, and the opposite side. Hold it. Okay. No bruise present. I'm gonna feel for crepitus, and we're gonna do a little range of motion, okay? Can you bend your head up and down and shrug your shoulders against resistance? Okay, and we're gonna do that with your arms as well. Can you hold them out? Out, up, down, okay? And we're going to, almost like you're cupping a bowl of soup. This is called supination. Can you pull up? And then pronation is on the bottom, okay? We're gonna do something a little silly, okay? Can you touch your finger to your nose? Okay, touch my finger, touch your nose, touch my finger, touch your nose, touch my finger. Great job. I know it's a little funny. I'm gonna assess your radial pulses. They are equal. Did you feel any discomfort in your arms when I was doing that? Okay. Are you comfortable if I lay you back? When's the last time you had a bowel movement?
Yesterday.
Yesterday? Okay. I'm just assessing your abdomen. There's no abdominal aortic aneurysm present. I'm going to listen to all 4 of your quadrants. Bowel sounds were present in all 4 quadrants. And now I'm going to palpate, which means feel all 4 quadrants of your belly. Okay. Did you feel any pain when I was doing that? All right. Now are you still comfortable? Okay. I'm going to listen to your heart and lung sound. I will start with your lung sounds, okay? Here's your bronchial sounds, which are very high-pitched. Your bronchovesicular, which are medium-pitched. And your vesicular, which are lower-pitched. Okay, the breath sounds are present in all of those, and now I'm going to listen to your heart, okay? Your aortic landmark is in your 2nd right intercostal. Your pulmonic is in your 2nd left intercostal. Your Erb's point or 2nd pulmonic is in your 3rd left intercostal space. Your tricuspid is in your 4th intercostal space. And your mitral or your point of maximum impulse is at your 5th left intercostal space along the midclavicular line, okay? And now I'm going to move down to your legs. I would assess your femoral artery, your femoral pulse, I should say. Could you bend your leg for me? Okay. Your popliteal pulse, your your posterior tibial and your dorsalis pedis. And on this side, you can lay that leg down. Okay. Popliteal, posterior tibial and dorsalis pedis. Okay. And now we're going to do some range of motion in your legs. Okay. Can you bring your leg out and in, and the other out and in? Can you lift your hips up? I know it looks a little silly. And now, can you kick my hand? Hold it. Good. And bring it down. Hold it. Good. And pull up. Hold it. Good. And down. Good. I'm going to assess your legs for any edema, which is swelling, color, temperature. Okay. Any discomfort when I was feeling those? All right. Now, is it okay if I bring you back up and we sit up on the side of the bed? Okay. How's the family doing? Good. All right, we'll just swing your legs to the side. Do you feel any dizziness? Okay. I'll listen to your lung sound, your posterior lung sounds while you're sitting up. Your bronchovesicular, which are medium pitched. Bronchovesicular, and your vesicular, which are again lower pitched. Okay. Your costovertebral angle. All right. Do you feel any discomfort when I touch your spine? Okay. All right. And now, can you stand up for me? Can you bend over and touch your toes? Your spine is in alignment. Okay. You can stand back up. Can you walk towards me? Great. March on one foot. And can you step on the scale, please? Okay. Give me your height and weight. All right. You can step off. Do you need to use the restroom? Or can I get you anything? Okay. Would you like to go to bed? Sure. Here's your call light.
Thank you.
Is there anything else I can do for you, hon? I'll be back to check on you in an hour. Okay, washing my hands and